All right, everybody, welcome to another live briefing with Dan Kuperstein and Ray Kim, the regulars right now for the live briefings. I know we're going to be changing that up. We have a couple things on the horizon. So, Ray, we're going to be going to some other SMEs. I'm sorry, but, as it relates to this topic, you're the man. Outside of Dan Kuperstein, you've been busy. All these e-alerts and compliance changes, tracking all this stuff through the holidays. I know it's been real busy. So we got some things to cover related to, the mandate. Talk about, is it a mandate? It's gone, right? We'll talk about that. Some other things that are happening. But Dan, let's get started right away with this whole, we were nervous as heck going into the holidays and looking at some of these deadlines for the employer mandate. So thank goodness, right? Woo, it's done. No worries. Supreme Court kicked that thing out. No worries for any of us. We don't have to regulate anything. Is that really right?
Well, almost right. Yeah, I think the good news is
not really.
Yeah, not 100%, but yeah, I think the good news is right. This thing was going to impose some very onerous requirements on employers with 100 or more employees, and it looks like the bullet has been dodged for the most part. But let's kind of go through. There are still some mandates out there, and there's some things that I think are some good things to understand. So I'm going to try to break it down, give a quick timeline overview of everything that's happened. It has been kind of like, well, we don't know what's going to happen next with this. We don't know what's going to happen next with this. But I think right at this point, we have a very good understanding of where things are, or where they're likely to be for the near future. So it's a good time right now. Going back to November 4th of 2021, right? OSHA, I'm sure most of you are familiar. OSHA released its emergency temporary standard regulation, commonly referred to as the federal vaccine mandate, requiring employees of large employers with 100 or more employees to get those employees vaccinated or test negative on a weekly basis by January 4th initially of 2022. There were other requirements as well. They had to provide paid leave to get vaccinated. Employers had to implement a vaccination or testing policy, which was quite onerous and required proctoring and other things, and other compliance requirements. It was a lot, right? Then on November 12th of 2021, the Fifth Circuit Court of Appeals issued a decision that staying or blocking the ETS, which prohibited OSHA from enforcing it and implementing it. And then that decision was appealed to the Sixth Circuit Court of Appeals in Ohio. And the Sixth Circuit Court of Appeals lifted the stay and said, actually, this is needed for the workplace. OSHA announced it would begin enforcement of the ETS on January 10th of 2022. And we should also mention during this time, as we've been posting to our Compliance Resource Center page, and we'll have a link here for you to check it out. There's been a lot of updates and changes that have occurred with respect to other vaccine mandates applicable to federal contractors and subcontractors. We generally refer to that as the federal contractor mandate, as well as to certain healthcare workers that work at facilities funded by Medicare and Medicaid. That's commonly referred to as the CMS mandate. So there were a lot of changes going back and forth there in the federal courts. But then on January 13th of 2022, so very recently, the U.S. Supreme Court issued a temporary stay order to block the OSHA ETS and sent it back down to the Sixth Circuit Court of Appeals for final determination. And on that same day, the Supreme Court upheld the federal vaccine mandate applicable to healthcare workers. That is the CMS mandate. However, the Supreme Court did not actually consider and therefore did not issue a ruling on the federal contractor mandate, which remains currently stayed or blocked by the 11th Circuit Court of Appeals, and as a result, that's kind of on hold, and it's expected to be on hold at least until April of 2022, when that court will be fully briefed on that matter. So as a result of all this, right, private sector employers are still able to implement their own mandatory vaccine testing policies if they want to. At least from a federal law standpoint, assuming they comply with state and local rules. But the good news here, I think, is that it looks like the good news, at least, is that large employers, 100 or more employees, right, are no longer required to do this OSHA vaccine mandate. So that's the good news. But
bad news?
So that's the big takeaway there. So I realize that was a lot, but all the back and forth has been like, It's
So
been fun.
CMS upheld.
Yep.
FCM, we'll find out in April, right?
Yeah.
We'll see what they fully
Federal
think
contracting.
about
Yep. Yep.
that. And then everybody else that's been nervously awaiting what the final decision is going to be, not necessarily a complete get out of jail free card here, given what you just mentioned about local jurisdiction and the regulations that may be happening at the state and city level and things of that nature. So maybe, talk a little bit about, we have a large audience here, New York, Philadelphia, what is it for those organizations in those areas that are still, required? This doesn't absolve them from that, right?
I'm sorry, what was
this does not absolve them from any of that.
Yeah, exactly. So I think, well, this is great news, obviously, from the federal standpoint, because there's no more federal mandate. You do definitely have to keep on track of all the things that are happening at the state and local level, right? So if you have your own employer vaccine mandate, there are some states that have made it very hard to do that, like Florida or Texas, for example. And then, of course, there are some states that require, some local jurisdictions that require certain types of vaccine mandates, like New York City, for example. Right. So I think you still have to keep on top of, especially if you're a large national employer, you're, coast to coast or in many different states and jurisdictions, you still need to be watching all of those different things at the state and local level.
So, Ray, I want to get you involved in this. You're talking to a lot of your clients as it relates to these things happening at the local level. Any change in direction? Have people been waiting for the decision, and has that changed anything? People preparing for stuff and then saying, all right, we're going to put it on hold, or were they just simply waiting for this decision in anticipation of it actually being kicked aside at the federal level?
Yeah, well, I'm sure Dan agrees that we feel a little bit like a yo-yo with the decisions that have come down from the various courts. I mean, the volume of questions kind of ebb and flow with these announcements that are made at the federal level. We do have clients, obviously, in these major metro areas, and a large majority of them are still going down the line based on the local rules in place. And what we have to remember is that if you are an employer who is in one of these major metro areas and still go down this road with respect to vaccination mandates, there are still a lot of considerations as it relates to testing, cost, and just the logistics of it as a whole. So that is still continuing, but for sure, the volume almost immediately reduced, Brian, as soon as the Supreme Court weighed in.
Just in time for questions to start arise about testing and test kits.
You betcha. You betcha.
You thought you were not going to be busy. You thought this was the end of it. Now, all of a sudden, in addition to the alert that just went out, Dan, just recently on the SCOTUS decision, additionally, now, there's some information that we have to sift through and understand how it's going to play out as it relates to all these tests that are going to be available to us and paid for by the carrier. So it should be easy to understand and follow, correct?
Well, we would think so, right? But it's been very challenging from an administrative standpoint, I think, for people to kind of understand how this is going to work, and with respect to their carriers. And I'll let Ray talk a little bit more about what some of the carriers have done. But as far as what the rules are, there's these new guidance came out effective January 15th, just 4 days ago, allowing group health plans and health insurers to cover the over-the-counter cost of over-the-counter COVID-19 tests up to 8 per person on the plan per month or per 30-day period, depending on what the group health plan or insurance carrier wants to do. That could be a lot, right? If you have a family of 5, that includes all the dependents on the health plan. So if you're, let's say you have a family of 5, that's 40 tests, 40 over-the-counter COVID tests per month, and that's a big change that's happened, and we've seen a lot of questions about that. It seems like many different carriers are doing things a little bit differently. So I don't know if Ray, maybe you want to talk a little bit about kind of what you've seen and some of the different things the carriers doing.
Yeah, sure. Well, all of the carriers have acknowledged the requirement and are working or have a solution in place, but the range of solutions is what is interesting, because every carrier is doing it somewhat differently than the next. So you've got to be really paying attention to what your particular carrier offers. And of course, we are here to assist in understanding what your specific carrier is doing from a solution standpoint. A little bit more complicated for larger employers who might have multi-carriers, and the consistency in which that is being delivered is something that you also have to consider as well. But by and large, I think, and we talked about this, guys, I mean, a lot of the employers are heading down the road of a vaccination mandate, and there's some confusion. Maybe there's a little bit of, trying to circumvent some cost that are associated with these tests. And so when the OTC mandate came down for it to be paid through the plan, a lot of the questions that we have been getting is can we use this as a mechanism to then pay for the testing that we want to have done relative to our own mandate? And we need to be clear, and Dan, I'm sure you can underscore that this is not supposed to be used for an employment purposes. And as such, you'll see the carriers responding as such. Some carriers have gone down the road of actually, when you do a reimbursement, you are going to have the member sign off on an attestation saying that this isn't for employment purposes. And so that messaging has to come out clearly when you're communicating to your employees, as well as you not using this as some mechanism to then use it for your own vaccination program.
So does that mean when I go across the street to Rite Aid, I take the Binex off the shelf, I go over, I get a Milky Way, go to the front counter, they're going to hand me a form and say, oh, hold on a second there. You got to sign this off here, or they're going to send me to the pharmacy. Am I allowed to get the Milky Way? I mean, how does this all work? I mean, how you're talking about something that, the test kits themselves available through multiple sources. I would assume that this is something that is, you go to your pharmacy, you use your card, there's a process there. Yes, they make you sign off if the carrier has that stipulation, which I'm sure they would check. But is that typically what we're talking about here, or is there more to it than that?
And there's more to it than that, Brian. I wish I could say that every carrier has adopted one single uniform strategy, but that simply isn't the case. Mm-hmm. We have some carriers who are saying, save your receipt, do the old school, pull down the form off the website and submit the receipt to the insurance carrier as well as the attestation form, and we'll get your reimbursement. Some have decided to do it through the pharmacy program. So you buy the Binax now, or the applicable test at the pharmacy counter, and it gets, show them your ID card and it gets paid through that way. Some have decided to do it through the medical plan as well. As a self-funded employer, typically what we have been seeing here is that this is going to be on the burden of the pharmacy benefit manager at the employer's cost, of course, right? Because it's going to get paid through as a claim. So there are a range of methodologies that the carriers are adopting. And so we've got to be understanding what your specific carrier is doing. And again, I reiterate, reach out to your account management personnel and we can get you that information.
Yeah, so every carrier may have differences in how they approach us. I really honestly hope that, this isn't one of those situations where there's a rebate for something. You're like, oh, wow, it's going to be covered. All you need to do is fill out these 5 forms, download this, save this number, make sure that you input this into our portal. I mean, I forget, Julie and I, my wife was just talking to me about something that we could be reimbursed for. It had nothing to do with healthcare. And for the amount of money and time it would take to go through that whole process, you're like, why would we even do this? Hopefully it's not that case. Hopefully it is a situation where we go across the street, get the test kits, and it's a process that takes care of itself through normal means. But I guess to your point, Ray, all of us, depending on our situation, our carrier and their process, we're going to have to check with our teams for those clients that are with us and with the carrier specifically to know what to do with this. But yeah, and an easy process.
Yeah, exactly. And also we've also got to understand that the government has released tests as well, accessible to families as well, which Dan, you can speak a little bit more to, because these are not inclusive of those tests as well, right? So we're talking about
that's right. That's a good point. So as of yesterday, individuals can also get 4 free rapid tests per household. So all households in the U.S. can order one, beginning now, essentially, and they get one set of 4 free at-home rapid tests from the U.S. Postal Service. Limited
Sorry,
to
I didn't mean to laugh, but you said rapid and you said U.S. Post Office in the same sentence.
Yeah, rapid and U.S. exactly. It's an oxymoron, I think. So the shipping starts out in late January. And one of the interesting things here, and I'm seeing this on social media and people are talking about, is that you really need to make sure that you check your control line on the rapid test, because apparently if these rapid tests are mailed out in cold weather that's below 37 degrees Fahrenheit, there's a chance that they freeze and that they don't work. Right. So that's something you just didn't want to make sure there's that red control line test on there and that it's clear, because that'll probably mean that it is working. But
is that, I don't know. I'm thinking of something completely different now. So you mean, well, what happens if you're getting these tests that happens? Are you reimbursed for that was an invalid test? I need a replacement for the 8 that I get. I'm sure that there's no clarification on something like that.
Yeah, obviously this just happened.
Right?
This just happened. Yeah, so I have no idea. This happened like basically last night. So
okay,
where I'm sure there will be something. There was also an issue where people who live in apartment buildings, some people who live in an apartment building, they were registered. The government was thinking of them as households, the whole apartment building, right? So in other words, when the first 4 people at unit 1A or whatever it was ordered their tests, then the rest of the 300 people in that apartment building could not get the test because the 4 tests were already sent out according to the website.
The U.S. portion of this.
Yeah, so there was we're talking about the U.S. Postal Service portion of this, right? And like we said before, right, this is in addition to the 8 free tests that you can get through your carrier for free if you're an individual participant. You can get these additional 4 tests from the federal government through the Postal Service. But this was a big issue because a lot of people complained, saying, it says I live in a household. I don't. I live in an apartment. I put my unit number in and it didn't work. But apparently the U.S. government is aware of this and they're going to be fixing that. So they did address that issue. So.
By the way, does this have anything to do with the tests that were available? I live in New Jersey, and we did order, and I think it was 4 tests that we got through the portal that the New Jersey set up to send you out free tests. Is that different than the U.S. Post Office, which is also different than obviously what we're talking about over the counter and reimbursement?
Yeah, yes, exactly. So this is a federal U.S. Postal Office thing on top of any state. That would be a state program. So anything on top of what your state or local government is doing. So I know like New York City, for example, does a lot of things with free tests that are available. So this is just an additional federal thing you get. Okay,
so check out your state. You never know. You may have additional tests available through them. You got your 4 tests that could be coming to your household as it relates to, or explain, household or individual, the 4?
It's 4 per household.
Household, right? That's what we got. So, okay. And then you got everything that we were just talking about. I just saw something pop up here. Since the ETS is on a stay, is the corresponding OSHA reporting also on hold?
If it was part of the OSHA ETS on the vaccine mandate, then that is on stay. I don't believe there was any. I believe there's a separate reporting. I believe there's a separate OSHA reporting rule, but I have to double check that. I didn't review that before this call, but if it was a separate rule, separate from the one that the Supreme Court ruled on, that one I don't believe was affected. But we can look into that.
Put it this way: if there was a rule for reporting on the CMS, most likely that stays. If there was anything on FCM reporting wise or the rest of it, it's one is on hold until April till we get clarified. The other is on hold until it's finally done. But it sounds like it is.
Right. Exactly. And there was like state OSHA, like Cal OSHA, for example, had its own reporting and mandate. So there's some states that have their own OSHA reporting requirements as well. So it's very, very complicated. So if you want to shoot us an email and get really specific, as to exactly what you're referring to, we can certainly get back to you and let you know. But my understanding is that everything related to the OSHA ETS vaccine mandate that affects private sector employers of 100 or more employees has been stayed and is likely not to be revived. So,
Okay, I'm going to ask you, this may be a question that requires more of a legal response, but I want to first start with Ray. Ray, as you were talking about the employers who are looking to go forward with a vaccine mandate of some sort, and Dan, you're saying that, you know, you got to be careful of how you go about that. What if, you know, we were on the CDC guideline page just recently for our own purposes to make sure that we're updating our pages for our own employees in our company, right? Mm-hmm. And if we were to say, hey, everybody, we want, as we've always said, we want you to be safe. We want you to follow CDC guidelines. We want you to make sure that you're wearing masks appropriately, you know, when you're in crowded spaces for your own safety. And we want you to, we suggest or recommend that you get tested should you want to make sure that you are safe and making sure that others are safe in your work environment. We suggest that you take a rapid test just to be sure. Okay, I'm clearly trying to stay below a certain line there, in hopes that if I were given that kind of direction, would I get an uptick if my purpose was to try and get more and more people to identify whether or not they have COVID or don't have COVID, to make my work environment safe, which is what OSHA was trying to do, but obviously it's not law. Am I stepping over, do you think? Am I getting into that area where you said earlier, you
well, keyword is
can't use this for an employer program?
Yeah, the key is suggested, right? So if you put words in your policy like it is suggested, it's recommended that you do this, right? It's not some kind of screening requirement or mandatory, you know, you must produce test results by X date or there will be disciplinary action, right? You know, then that should be fine if it's just sort of recommended or, you know, what we suggest you do, right? It becomes problematic, right, when you cross that line and it becomes a workplace requirement, because at that point that takes it outside of, you know, that would be, at least with regard to, for example, testing, right? If we're talking about testing, you know, that would take it outside of that new FAQ guidance we got on the cost of the plans that would make it free to participants, and the carriers could impose a much higher cost. So
I just recently saw a stat that close to, I don't know what it is, 70-some% of the people so far in the United States have at least one shot of the vaccine. And then in different pockets, whether it be, you know, where we're at currently, Philadelphia region, New York region, all those, that it's even a little bit higher potentially, right? So at the end of the day, I mean, Ray, how big of an issue is it for employers? I mean, everybody's different, but is what in October was a bigger issue? Is it much smaller in terms of the population that we're talking about that would even have to be, if you're looking to mandate, that you're actually mandating a testing on an ongoing basis?
How would you know if you don't ask, right, Brian? I mean, so I think the whole idea of this and why employers are asking a lot of the questions to us is to try to avoid a cost that may be there for sure, right? But how do you know if you don't take the time to survey your employees about whether they're vaccinated or not? When this was heading down the road where it was going to be a mandate, we understood that the testing was the most significant pricely component, particularly if you had to do it every week. But if you are an organization that has 99% vaccination rate and only a handful of people that are needing to have been tested, assuming that the employer has chosen to do the alternative, I mean, you could simply say work from home too, right? Which would negate the cost as well. But if assuming that you did want to comply with some type of testing alternative, well, it might not have been a large financial impact. And so for those groups that are continuing down this road or living in a metro area where it's required, you have to find the data first. The data will drive the decisions that you make relative to whether or not you're doing a vendor who is going to come out and do it or whether you do it in-house. And so I think that needs to be, and we've said this on every single webinar that we have done with COVID-19, that this is the starting point for some type of deeper analysis onto the fiscal impact of doing this testing.
Yeah, so it still comes down to the employer's appetite for how far they want to go with any of these types of guidelines or mandates if they so choose. Outside of the testing that we're talking about here, as it relates to COVID overall, you know, I look at the time and I try to end these live briefings with more of an overarching outlook as to what we're dealing with. So Dan, you know what's coming. I'm going to ask you, what are some of the things that the employers need to be aware of beyond what we've spoken about today? And you've already mentioned some of the things related to states and how states differ. Maybe just give me some ideas of what they should be. If they leave here today, what are some of the actions that they should be taking to make sure that they're prepared moving forward and finally with all of this?
Yeah, I mean, that's a really good point. I think you really want to look at this if you're a national employer, look at every different state and local jurisdictions rules on vaccine mandates and testing to make sure you're in compliance with these different things. Because yeah, it's one thing to say, look, the federal mandate is gone. We don't have to worry about the federal law imposing this on us as a private sector employer. But there may be a rule in your state or city that changes that. Or let's say you create your own employer test. You know, let's say you've created your own employer vaccine mandate, right? That may be very difficult. That will be very difficult to enforce in a state like Florida, right? Or Texas, which have made that very difficult to enforce. And similarly, if you want to do mandatory testing, let's just say, for example, in California, there's a state law that requires the employer to pay for that, right? So these are just some examples, right?
Awesome. Where do I go for that? Do I go to Wikipedia, Amazon, Guitar Center? What
was the question?
What online source can I go to other than the ones I mentioned? Now, where's that all housed, or do you have to go state by state for that information?
I mean, you really have to go state by state and locality by locality. Unfortunately, it's you're talking about hundreds of different jurisdictions if you think about it, right? But at the end of the day, we know the big ones, right? We know that it's very difficult to enforce it in Florida. We know that it's to enforce a vaccine mandate in Florida. We know that New York City imposes very strict requirements on things and on vaccine mandates, and we know that we know basically where the big ones are. Right. California requires you to pay for testing. Right. So, we have a very good understanding of that. And we can obviously, if there's a specific, any clients of ours that we want to reach out to us on the compliance team, we're happy to do much more specific analysis for them. But ultimately, it's something that your account team can help you with, your Corporate Synergies. And that's what we're here for. So.
Yeah, we always think, well, eventually after this is all decided, it's going to get a lot easier. We can just go back to standard plan designs and answering questions about health benefits and, everything will be fine. But that's never the case. And that's why we'll continue to do these live briefings. There were a few other questions that came up I saw on chat. We want to make sure that we've captured. I think your emails are there, so we'll make sure that we get back to you on that. Again, as always, Dan mentioned some of the resource centers that you have available to you. Always check in with us on our compliance pages, our resource center, all the thought leadership that we're putting out. We'll have more of these. We're going to continue to have more live briefings on various topics coming up. In fact, Dan, I think we have one coming up on transparency rules and what the employer is responsible for. We're clarifying more of that coming up in a little bit. Is that right?
Yeah.
So
that, definitely.
Keep an eye out for all the great events that we're going to be holding. With that, thank you everybody for joining us. We'll make sure we have this available on demand, and we'll see you live at the next live briefing. Thanks a lot, everyone. Take care.
Thank you.